everyone, and welcome to this episode of Wellness Unscripted. I am Kara Merrick, a functional medicine nurse and the owner and founder of Unscripted Clinic. So today we are excited to have Dr. Amylia Shayne with us. And Dr. Shayne is a board-certified doctorate nurse practitioner with over a decade experience in healthcare. She's really passionate about improving women's health, especially during the postpartum period, but was inspired by her personal journey through hormone imbalance and with an autoimmune disorder. As a mother of two, Dr. Amylia understands the unique challenges that women face, and her expertise in hormone optimization and holistic patient care makes her a trusted expert in women's health. So her clinic in Boise, Idaho is called Bloom Women's Health, and is dedicated to empowering women to take control of their own well-being. So thank you, Dr. Amylia, for being here, and we're excited today to discuss some trends in women's care.
Thank you so much for having me. I'm so excited to be here. I think this is finally getting the publicity and the exposure that it deserves. We know that women are very rarely the topic of conversation or we just don't get the credit we deserve for running the world, basically. And
yeah, absolutely.
We are finally making some headway, and I'm really excited to be a part of that.
That's great. Well, thanks again for being here. So first, I want to start out with just getting your perspective. I know that you and I both had started in the allopathic field, and certainly I wouldn't consider myself in the allopathic field anymore. I think we've both kind of grown into keeping those roots in science-based practice, but also incorporating some alternative medicines and some natural remedies. So I just want to get your perspective on what have the trends been in women's healthcare that you've seen, and how has that shaped your practice?
Yeah, absolutely. I think that that's so valuable. I think at Bloom, our goal is to be in the middle. So again, I started in very conventional allopathic medicine. I was a HEMONC BMT nurse for lots and lots of years. And I started in conventional primary care and urgent care. And I just felt like I kept practicing medicine with my arms tied behind my back. Insurance dictates just about everything we do in the conventional medical system. And my co-founder and I, again, we're just sitting there going, like, I feel like I'm practicing medicine with my arms tied behind my back. And I worked so hard to get here, and I hated it, honestly. We both were feeling so burnt out on the conventional system, and we didn't feel like we were really helping anyone. We kept having women come in with recurrent UTIs, and, the only thing insurance covers is another round of antibiotics. And we just kept saying, as patients, as women, we were looking around and going from, our 7-minute appointment with our OBGYN, who's like, no, your labs are fine, everything's fine, to then swinging the exact opposite way and spending thousands of dollars going to a functional medicine provider. And we really and truly felt like there's got to be a way to be in the middle, right? Can we pick and choose the best pieces from both? Because I do think that there's still some value in some of the allopathic modalities. Yeah. And I think that women should have the ability to have holistic care. We should have access to some of those functional medicine, roots, looking at root causes, making sure that we're looking at the whole picture. So when we do need to treat your bacterial vaginitis, we know that we also really need to repopulate your gut. We know that our gut microbiome and our vaginal microbiome are so interconnected. We know what burden our gut is for our serotonin, right? So I think for Bloom, we really and truly decided to build the practice that we couldn't find as patients. And by changing the model a little bit, we offer a direct pay membership model here at our practice. We're able to kind of buck the system and pick and choose the best of both worlds without ending up in either of those extremes. And I think for our patients, that has been really beneficial. I think some of the trends we're seeing in women's health is there's starting to be so much more access to information, right? Social media has been phenomenal. We're talking about hormone replacement therapy. We're talking about how important the gut is. And I think that access to information is probably one of the biggest trends. I've had patients come in and they're like, I've heard of a Dutch test, and I've heard of these these things. And it's so refreshing to hear women be empowered with information, whether that is the right test for them to do at this time or not. The fact that women are getting access to information and it's not being, kind of gate kept by those of us in the conventional system. I think that has been super valuable. And that's, I think, one of the biggest trends I've seen. It's finally getting talked about. We're talking about different modalities. We're talking about, how can we work within both systems? And I think that that's something I'm really excited about.
Yeah. Yeah. I've seen a lot of those trends too. I'm really excited about that also. So tell me about some of the things, the trends in women's healthcare that you're seeing come up that you're really excited about, that you get to treat patients with.
Yeah, I think that's such an awesome question. So when we opened our practice, we really honestly thought we were going to kind of fall into that like perimenopause, menopausal group of women, right? They are the ones that have access to the education, they're talking to their girlfriends, they have the means to do something kind of outside of the normal insurance-based allopathic conventional medicine. And one of the things that we've seen, and I'm so excited about, is that we actually have more patients in like the 25 to 35-year-old range than we even do in the menopausal range. And that makes me so excited because it means that if I had access to this information at 25 instead of 30, I would have been in such a healthier place to begin with, right? And I wouldn't have had to like piece together things. And so that really makes me excited that it seems like this younger generation of women that are not, they're just not, I don't know, they're not putting up with what we put up with. I feel like they are going to their provider and they're saying, I don't feel good. And their provider's like, oh, no, your labs look fine. Like, you're beautiful. Like, you're 25. You should be feeling great, right? And you look on the outside. So you get completely gaslit and pushed aside. And these 25-year-olds are saying, no way. Like, I know something is going on. Again, they have social media. They have more access to the information. And they're willing to, like, kind of look outside and know that there's something else that could be out there. And that's been super, super exciting for me.
Yeah. I totally agree. We all know that health is compounding, right? So when you're thinking about living longer and better, you want to make sure that you're doing the work to make that worthwhile. So the things that you're doing, a penny today in health terms is worth $1 tomorrow. And the sooner that you can start and just even understanding the factors that go into building that healthier, more robust being, is so important to start early. Even though women in their 20s, it's hard to think about being in your 50s or 60s when you're in your 20s. But it's kind of a blessing and a curse that women now have the access to the information like you were talking about, and the desire to understand their own health. These are things that, I certainly wasn't taught in high school. These are basic health, principles of health that you're not taught in high school. Your parents probably don't know. I wasn't even taught in nursing school. So it took me going out on my own to learn these things that are just so foundational for overall health. So I'm so happy to see that younger people are starting to realize, hey, there's more to the story than just living your life and being free of disease. That's not where health is created. And unfortunately, we live in a time now where health is not a given. It's something that you do have to do consciously and thoughtfully and put some work into.
Yeah, I think that's so valuable. I love how you said that. I think, too, it's really interesting for me. I think one of the other trends that we have seen and I have experienced personally as a patient is this term millennials. So, I'm 32, right? I had two babies. My youngest baby was turning 3 this month. And after my second baby, I just felt like I kind of dropped off the cliff. Again, I looked fine again on the outside, but I was kind of screaming from the mountaintop that I felt like something was wrong with me and nobody was listening, right? I looked fine. So, you're fine. And when we started our practice, again, we're very hormone focused. We know how valuable and important, like you said, hormone health is for the longevity and the quality of our life, right? At 32, my testosterone level was literally 0. Mm-hmm. And the thing that makes me a little bit concerned and the thing that I'm hoping to change is that nobody in the conventional system or even some of the functional systems would have touched me with a 10-foot pole until I was quote unquote perimenopausal or menopausal. So another 10 to 20 years from now. And like you were saying, a penny today is a dollar later. If I had been completely withdrawn from hormones for another 10 to 20 years before anyone would treat me or replace that, that would have made an incredibly detrimental impact on the longevity and the quality of the life that I would have had.
Yeah.
I think it's really important that we listen to women, right? I think that that's just the biggest trend and the biggest takeaway is that if a woman is telling you that something feels wrong, we know our bodies. We are much more intuitive than we give ourselves credit for. And that's something that I've had to find my way back to, and I'm continuing to work on. But if somebody says that something is wrong, the first step is just to listen to them. Okay, sit down, have the time and the space to listen and say, okay, let's make a plan together. And I think seeing women and listening to their concerns and treating them, I tell my patients all the time, if you had type 1 diabetes and your body was not making insulin, nobody would ever tell you, well, you shouldn't replace that insulin, right? Yeah. But yet with women, we say, well, oh, your body's not making testosterone or estrogen anymore. Well, it just isn't, right? So that's just normal aging. But yet that's not normal if it were another disease, right? And so I think it's really valuable to change the way that we are listening to women and the way that we're treating women. And instead of this being like, oh, women just kind of go out to pasture at 30, 40, or 50, right? I mean, we're living, like you said, such longer lives than we used to. If I would have spent 70 years, I probably wouldn't have made it another 70 years, to be honest with you. And so I think, like you said, making sure that we're making some of those preventative changes now so that we have as women actual true health and longevity versus just being alive. Like there's a very big difference between living your life and being alive.
Absolutely. Can you talk to me a little bit about treating with testosterone therapy in women? What are the complaints that these women are coming in with, and what kind of leads you to the decision that testosterone therapy might be a right call for them?
Yeah, I love that. I think testosterone is something that women very rarely, again, I think we're finally getting there, but when I see patients, they still go, wait, I thought testosterone was a male hormone, right? That's something that we talk about frequently in men, and yet women have more testosterone than estrogen in our bodies, right? If we're looking at them comparatively. And testosterone is incredibly important in both females and males. So testosterone is incredibly important for muscle, like health and skeletal muscle mass, which we know is a huge marker of longevity, right? So incredibly important and protective for brain health and bone health. So women are actually 2 to 3 times more likely than men to develop Alzheimer's. And we think that that is actually partially because women withdraw from these hormones, around the menopausal age, and men do not. I mean, there's a much gradual
taper decline.
Yeah, but women just straight up drop off a cliff. And so when I'm speaking with women, often what we hear in women that are testosterone deficient or androgen deficient is, brain fog, achy joints, feeling unwell, right? That's kind of that common, I just don't feel that good. Yeah. Chronic fatigue, inability to change their body structure, right? So I'm working out like crazy and nothing's changing. Yeah. Again, using myself as kind of a case study, I was 32. I was doing all the things. I was working out like crazy. I eat super healthy. I know all the stuff. I'm doing all the things and nothing's changing. And I felt like an 85-year-old man stuck in a 30-year-old woman's body. Like, seriously, getting down on the ground and playing with my kids and getting back up felt like a huge chore. Yeah. And so I always explain to our patients that this medicine should always be individualized, right? I think that's one of the things that I love the most about the functional medicine space is it's really and truly tailoring all of our options to the individual. Yeah. And so I explain to my patients that in almost all circumstances, we have kind of the Goldilocks of options, right? We have a really conservative option, we have a middle of the road option, and then we have an aggressive option. And how you fall into which path is something that we get to choose together. We use a combination of your labs, right? So for me, my testosterone is 0. My body, no matter what I give it, probably isn't going to make any more testosterone. I've been doing all the things, nothing's happening. So for me, a super conservative route probably is not going to get me to where I need to be, right? From a safety standpoint. However, for my 25-year-old patient whose testosterone is suboptimal, but she is making a good amount of testosterone, a super conservative option is absolutely the right place for us to start for her. So giving her something like DHEA and pregnenolone to be able to kind of give those building blocks and give your body the support that it needs to be able to boost that testosterone or optimize it, right? Whereas like for me, I have 2 little kiddos that are, crawling into my bed at night. I have no testosterone. My body's completely withdrawn from it. So for me, the aggressive option was the safest and the smartest. So at our practice, we offer kind of a wide range of hormone replacement options. We use body identical or bioidentical options across the board. However, the modalities in which you can get those medications vary widely. So there's testosterone cream, there's troches, there's pellets. I personally, again, because I have little kiddos that are constantly crawling on me as a mom, this, there's no personal space. A testosterone pellet was the most appropriate treatment for me. So it's a tiny little like grain of rice. It goes and lives sub-Q between your muscle and your skin. And it slow releases over 3 to 6 months, usually for women. Within about 2 to 3 weeks, I started to feel alive again. Like I treat my parents as well. And the way that my mom said it, I think is so spot on. But she was like, I felt like I came online again all of a sudden. Like I just started to feel like myself again.
Yeah.
And so it's pumped out via your cardiac output system, and it can be incredibly effective. However, just like anything, there can also be, negatives to that, right? So again, my 25-year-old patient who's making testosterone, giving her testosterone would be more detrimental to her than beneficial, right? When we replace something, very rarely does our body go, oh, cool, I'm going to keep making it, right? And bodies are pretty smart, right? If somebody else is doing it for them, they're not going to do it.
Right.
And so I think that that's what's so valuable. And I think, there is some controversy in this hormone replacement space between, there's polarization everywhere, right? Unfortunately, I think that's the name of the game in our society right now in all regards. But there's very strong feelings, pellet, non-pellet. And my thing is that it should always be individualized medicine. It should never be, this is what kind of practice we are. What kind of practice we are should be individualized medicine, right? Not a pellet practice or a non-pellet practice. It should be the best option for the patient. And that as clinicians is our role and responsibility to help guide the patient for the best modality for them.
Yeah. How do you feel about long-term treatment of these hormone replacements, whether it's testosterone or, and progesterone or any of these other supplemental hormones? Because when you're thinking about treating a 25-year-old, for example, what are they going to do when they're 60? Like, what does this look like from a long-term perspective?
Yeah. So again, so to contrast like my case versus a 25-year-old, right? Like if my body is not making any testosterone already, and I'm doing all the things, right? I'm watching my labs, I'm supplementing where supplementation is necessary. I'm, eating a clean diet, I'm exercising, I'm trying to build skeletal muscle mass physically as much as possible, and my body is no longer making testosterone. For me, the benefit outweighs the risk, right? Because my body is not making it, I need it. Similarly to, say, the type 1 diabetic, where their pancreas is no longer making insulin. They need insulin. So for me, replacement is going to be a part of my life until the day that I die. I mean, really, truly, that is my plan. And I explain that to patients, right? This is a long haul thing. Whereas I would feel malpractice for me to put a pellet in a 25-year-old who is making testosterone, because again, her body may say, oh, great, I'm done, right? In males, that's what our issue is often, is when they will start testosterone replacement, their body says, well, I don't need to make it anymore. And that absolutely tanks and can sterilize them in the long run. Their body stops doing it. So again, it has to be individualized medicine. That's why you cannot go to some med spa and go get a pellet because you don't feel good, right? And unfortunately, there are places, and that's where we're starting to get that bad rap, I think, for hormone replacement therapy. And that's what makes me really frustrated and sad, because this isn't the right modality for everyone. And in the 25-year-old patient whose body is making testosterone, they shouldn't be touched with a kind of a pole with hormones, right? They may need supplementation. They may need DHEA. They may need pregnenolone. They may need diet modification. They may need to learn better exercises for skeletal mass, right? Orange Theory is probably not going to be the best for you, right? You need to do, more weight resistance training and lower HIT training, right? So again, it's the education piece and the time that we actually get with these patients. I think the trickiest piece about this is, for us, it feels like a lot of common knowledge, right? Yeah. And yet, like you said, I didn't learn this in school. I didn't learn this from my parents. I didn't, this is all training that I had to do outside of my conventional training, which I have a ton of conventional training, right? I went to school for a million years, and I learned none of this there. And so a lot of times I think patients can feel like, oh my gosh, why didn't I know this? Or, well, why shouldn't have anyone have told me this? And again, it's just, we don't have the time and space in the conventional system to have these kind of conversations that are so valuable. For the 25-year-old, the 30-minute conversation about lifestyle modifications is probably more impactful than any medication I can prescribe her.
Yeah, absolutely. So in line with that too, moving a little bit away from specifically hormone replacement, but just in thinking about, your clientele as a whole, I know in my practice, I find myself coming back to the same couple of principles or the same foundations for just about everyone. These last couple weeks, it's been sleep. I just find myself over and over having to tell clients, no, sleep really is important for these issues because this is, XYZ. So knowing that, like, with respect to individualized medicine, there's of course foundations that just apply to humans as we know them. So can you tell me a couple things that you wish all of your clients knew?
Yes. Oh my gosh, I love that. And I think I'm the poster child for how important sleep is. I would explain myself as like a chronic insomniac. Like from childhood, I've never been quote unquote a good sleeper or an easy sleeper. And I have been like religiously living and dying by my Oura ring.
Yeah, me too.
And honestly, I can't believe how much of a difference, I think sleep has made more of a difference for me than any of the supplementation or other lifestyle or any of the medications, honestly, that I'm taking. The other night, I have two little kiddos. I always explain to my patients too that we live through seasons, right? There's some pieces of these seasons that I can't change. I can make tweaks to my, my sleep hygiene and my habits, but my toddler got up the other night in the middle of the night, and that's the season that I live in, right? So I had a night and most of the time they're sleeping through the night right now. So I am getting into that season where I'm getting more control over my sleep, and it's really on me again, right? Which is tough as a parent, right?
Yeah.
You have this short window of adult time, and you having to prioritize your sleep is really and truly that. These are things you have to prioritize, and they're not always easy. But I had a night the other night where my toddler woke up, and I got one bad night of sleep. I got some sleep deprivation, and man, did it make a huge difference. And I was telling my husband the other night, we were getting ready for bed, and I was like, I honestly think that the chronic sleep deprivation was part of the reason why I have felt as awful as I felt for many years, right? When just it's compounded, right? And it really and truly is. It takes a lot of time to kind of undo some of those things. So sleep is absolutely paramount in our practice as well. And again, it's not just you need to sleep more, because that's what you get when you go to your, wellness visit and you get 7 minutes. It's actually really giving our patients the tools of like, okay, these are the things that are actually going to impact your sleep. And, here are some of the things like, I love data. A lot of our patients love data. Like I said, I personally live and die by my Oura ring. However, data is really beneficial sometimes, and it can be anxiety provoking sometimes too. I know when I get a bad sleep score, I'm like pissed, and it's like positives and negatives. But so from a theme standpoint, I completely agree with you. I think that sleep is absolutely paramount. And again, giving people small, manageable changes that they can actually implement versus being like, you need to go from sleeping 4 hours a night to sleeping 10 hours a night. Like,
Yeah.
we're going to have to make some huge changes to get you there. So let's make all of these little tiny ones that are going to add up and that are going to be able to be continued, right? So I think themes for us are consistency and continuity. And so my thing is always like, I'm going to try to give you the tools that you can actually sustain, right? So we're big fans of 80/20. I probably say 80/20 900 times a day. I really truly believe that if you can make these changes 80% of the time, then the other 20% of the time, I want you to go have a dinner with your girlfriends and don't worry about what your food is cooked in, which kind of seed oils that they made back there.
Yeah.
Have the margarita, because I really and truly do believe that doing all of this work should be for something, right? We want to actually enjoy the life that we have. So if you can make these small but meaningful lifestyle changes 80% of the time, then the other 20% of the time, I want you to not feel the guilt, right? I think, again, as women, guilt is a very common theme for us. And
Absolutely.
we can get very hyper fixated. So, we often use a lot of the IFM diet tools, and we do use like the autoimmunity diet, a lot of our Hashimoto's girls, but I'm like, that is really and truly the only time I'm ever going to put a patient on a really strict diet, and it's going to be for a short period of time. And so I think consistency, continuity, and 80/20 are probably the biggest themes for us, making sure that we can give our patients doable, manageable, prolongable changes, so that they can actually enjoy the life that we're trying to get them to.
Yeah. Yeah, absolutely. I totally agree with you there. I follow the 80/20 rule too and advise a lot of my patients because it shouldn't be a chore. All right. I totally agree with you. And that 20% can give you so much joy and so much freedom. And that 20% is particularly important when you have kids, right? Because you're going to go out and, they go to a birthday party and they're going to have cake with, who knows what in it, or red dye number 40 a little bit. And to be, especially when you're parenting, to be so restrictive is going to be a detriment to everyone, especially yourself. You're going to hold yourself way too high, you stress out over it. And then whatever you've saved yourself from, the impact of the stress around it is far greater than what just eating the chicken nugget. So, yeah.
I do the same thing with our kids too, right? Like, and I say like, okay, I can control the things that I can control. We don't do diets at our house. We don't do, a bunch of added sugar. We do have gluten-free. My daughter who is gluten sensitive. But then when we go to the birthday party, there's not a single, again, I don't want to pass down that guilt either. Like we talked about, especially as women, especially, we watched a lot, we've got the almond bomb terms where I'm like, I want to teach her with my kiddos. We talk about short energy and long energy. So, there's certain foods that give us long energy, and then there's superfoods that give us short energy, and they're really fun. And I try to often talk to my kiddos about, both long energy and short energy can be good for us. They're just going to be good for us for a different period of time. And when my kids do have things like the red dye 40 cupcake at the birthday party, and then afterwards on the way home, they're like, oh, my tummy hurts. I really and truly just try to remind them like, hey, listen to your body. If your body doesn't feel good when you eat this, it's probably not giving you a lot of long energy, right? But taking that guilt and that pressure away is something I'm hoping to unlearn for my children. That, again, with our patients, since they are all women, making sure that we're not hyper fixating on stuff either, right? I think a lot of us have had at least restrictive tendencies, right? In the society that we grew up in. And I only think it's getting worse with social media. I have a daughter and it scares the shit out of me. And so I think trying to find, again, that 80/20 balance of these are the building blocks that I'm trying to teach you and that I want you to live your life. And I don't want you to be restrictive or guilt ridden or scared when you have those moments outside of that. All things in moderation are going to be good. And I think that's how I practice medicine. I think that's hopefully how I practice parenting. Who knows what mistakes I'm making, but I really and truly am trying to model for them living a life that makes me feel well.
Yeah. Yeah. That was, beautifully said. So I know that we could sit here and talk all day, but I'm going to wrap up with one more question. Can you tell me, what are your favorite healthy habits that you're doing right now to support your health?
Ooh, I love that. Okay, I love that. It is so hard. Because I am a spider web. Like I have
Yeah.
constantly got 900 things. I'm of course trying to absorb as much as humanly possible at all times. So for me, it's actually really been simplifying and trying to pare down all the things. So saying no to stuff is something that I'm
Mhm.
working really hard on right now. We opened a business this year. Being an entrepreneur is a whole other ballgame. Again, I have two young kiddos, and I'm really trying to prioritize finding some sort of work-life balance. I'm going to actually pull up a quote because this is, I think, as a working mom, been something that has resonated with me. It was Nora Roberts, and somebody asked her, how do you balance writing and children? And she said that the key to juggling is to know that some of the balls that you have in the air are made of plastic and some of them are made of glass. And that is something that I think for me has been where I've been trying to put my energy, is just realizing like there's some things that are more important than others. And the juggle is never going to, it's never going to be 50-50. It's never going to be, a one-to-one trade. And so saying no, I think, is something that I've been doing or actively working on doing for my mental health and my
Mm.
work-life balance. And then sleep. Again, I am like addicted right now to sleeping well. And I can tell you it has made the biggest difference out of everything that I'm doing. I would say, hands down, sleeping well and making sleep a priority has been the biggest game changer for me.
Yeah. Yeah. Amen to that. Well, thank you so much for joining us on Wellness Unscripted, Dr. Amylia. I want to give you a chance. Where can people find you if they want to learn more about you or Bloom Women's Health?
Thank you so much for having me. I feel absolutely honored to be here. Blue Women's Health has a brick and mortar clinic in Boise, Idaho. We also see patients virtually in Washington, Oregon, and Idaho, and we are working on expanding that. Again, we are a membership based clinic. So, just like your Netflix subscription or your Pilates subscription, you pay monthly so that there are no surprises. We have much smaller patient panels because of that, and we're able to make this a much more holistic approach to care. And I'm just super, super excited to be able to be in this space. Thank you again for having me.
Of course. Thanks for being here. And thank you all for listening. I hope today's conversation with Dr. Amylia Shayne has inspired you to take control of your own health journey by continuing to learn about the foundations and figure out what works best for you, because everything that you're seeing on Instagram, while it's great as information, they're not all applicable to you. So just keep exploring with what works and what doesn't work and learn to listen to your body. So whether you're looking to rewrite your health script or add chapters to your wellness journey, we're here to guide you. So if this conversation sparked any questions, comments, or suggestions for future episode topics, we'd love to hear it. So please drop a comment below or find us on social media at Wellness Unscripted. Don't forget to subscribe for more health tips and inspiration. And if you'd like to learn more about me and my clinic, visit unscriptedclinic.com or follow us on Instagram or Facebook at Unscripted Clinic. Thanks, everyone. See you next time. The content provided in this podcast is for informational and educational purposes only and does not constitute medical advice. Always seek the guidance of a qualified healthcare provider with any questions you may have regarding your health or a medical condition. The hosts and guests are not responsible for any adverse effects from the use of this information.